Okay, finally. Apologize for all the tech difficulties. Car mentioned that I'm at the University of Alberta, but actually I'm at the University of Iowa now. So just getting settled in and getting the new equipment to work can be at times challenging. I'm an assistant professor at the University of Iowa, but the paper that I'm going to present here was done at the University of Alberta with two of my co-authors, Damian Collins and Emily Grisey. And we looked at the mode-specific affordability of transportation in a car-centric city, which is Edmonton, Alberta, the province the capital of the province of Alberta. And the reason we decided to look into this issue is because aside from housing, transportation is a huge expanse. And while housing accounts for about 20% of household budgets in Canada and 30% in the US, transportation comes in second. And both of those expenses were on the rise, meaning that many policymakers started paying attention to the issue of affordability. And while the affordability of housing is a more established concept, because even from the late 19th century, there were discussions that no household should spend more than 1 week of their income on housing, and later it was codified by U.S. Housing and Urban Development Department to have a threshold of 30% as an eligibility for federal and social housing. More recently, a discussion emerged that transportation should also be part of that discussion, and we can see estimates of about 35 to 45% of total household income that should be dedicated to two of those expenses. I have a snapshot here from TransLinks, one of the transit agencies in Canada, strategic plan that puts it as one of their strategic goals to ensure that household spends no more than 45% of their budget on transportation. But in reality, this means that people who want to spend or try to spend less on housing, they have to move away from the activities. And we observe a phenomenon that is sometimes called in the literature as drive till you qualify. So basically, you're getting further and further out and you spend longer hours commuting. And there's definitely theory behind it, because even in one-union models or Alonso's models, they assume that or posited that the further you are from the center of activities, the lower the price for the particular land or the rental unit will be. However, when we're looking in the literature, this intuition is not readily supported, because the causality between the relationship of housing and transportation differs based on the type of proxies used for the exploration of that phenomena, or the type of context that is studied. And the overarching issue is that we don't really have good data to study the relationship between housing and transportation costs. And moreover, we don't, or previous studies don't always look into the full spectrum of expenses, pointing mainly to the expenses that come out of pocket, rather than accounting for such expenses as time that we spend commuting. So with this paper, what we tried to do was to empirically explore the relationship between directly reported housing and transportation costs. So we didn't use any proxies. We directly asked people about their expenses. We wanted to account for the differences in the built environment and transportation mode that they use primarily for commuting to work. And we also controlled for the time they spent on their daily commute, and introduced that into the analysis as well. And to do that, we relied on the university travel survey that we collected at the University of Alberta. It's a large university, about 40,000 students, and it is located in Edmonton, the capital of the province of Alberta in Canada. It's about a 1.4 million people metropolitan area. It's the 6th largest region in Canada. And we had 482 full respondents that were suitable for analysis. Although we had many more respondents in our survey, only those almost 500 people provided us with full monetary expenses information that we needed for the analysis. And probably all of you know that it's a challenge to collect such data. A few more notes about the region. The region is primarily car dependent. Almost 90% of people drive or are passengers of a private vehicle when they are getting to work. Only about 6% of people use transit on their commute, although the transit system is fairly robust at least in terms of North American context. We have a well-developed bus system, 3 light rail transit lines, on-demand zones, and paratransit suitable for people who qualify for it. And the campus that we focus our study on is located downtown. So we have a pure monocentric case where people commute from all parts of the region to the downtown campus. So that's their primary value or destination for their travel. And as I already mentioned, we asked people to directly report their both housing and transportation costs. And housing costs included mortgage if you're an owner, property taxes, utility for homeowners, and rent and utilities for renters. And this is a direct overlap with the shelter cost definition as it is asked in the Canadian census. However, for transportation costs, we asked not only for the price of ownership transportation modes, but also their use. So we collect information on public transit passes, private vehicle loans, private vehicle maintenance costs, private vehicle insurance, gas, electricity, parking costs, car rental fees, car sharing, and ride hailing if anyone used those. And to the best of our knowledge, there is no national or provincial data set that has that depth of information on housing expenses. Moreover, we also converted the travel time that we simulated based on the coordinates of their home locations and the university campus into the monetary value. And we used the method proposed by Kim in their 2019 paper, where they assumed that monetary value of travel time should be accounted as 70% of the average hourly income in the region, which is, for our case, is a little more than $30 per hour. And using this information, we started looking through the data. So I'll first do a few descriptive overviews, and then we'll get into the modeling. So what comes at this figure is that we can see the allocation or distribution of people who spend a certain percentage of their income on housing, which is the right side of every plot, which is the left side of every plot, I'm sorry, and the distribution of transportation expenses. So what jumps at us is that about a half of our respondents spent more than 30% on housing, and this percentage shrinks as we look into owners. So owners generally spend smaller share of their income on housing, and this balloons for the renters group. Moreover, for renters, we can see that about a half of those spend more than 10% on transportation, which obviously overshoots this newly emerged trend of spending less than 45% on both housing and transportation expenses. What we also can see is that when we're looking at the spending and modes people use, we can see that people who rely on transit and, well, primarily we see that across all modes, people spend the majority of their income on housing. However, people who walk and use transit spend more, which is consistent with literature, because if you want to use transit or walk, you have to live in those amenity-rich areas, which tend to be more expensive. Nevertheless, we also see that most of our respondents still spend less than 10% of their income on transportation. What is also interesting from this figure is that we see that while the people who rely on wheeling, and these are primarily cyclists, they come across all expense groups in terms of housing, they dominate the group that spends less than 10% of their income on transportation. So we see this as an indication of the self-selection bias, where people who can afford to live in different parts of the region and want to bike find those areas that are suitable to them. Lastly, but not least, obviously, we can see that the longest commute times, the longest commute distances are presented for car drivers. And while this is the distance that is longest, then even if we combine all other modes together, and you can see this map where the outer ring indicates the median distance that a car driver would have to cover to get to downtown or where the university is located. Given that it's a very car-dominated region, they can do it so quickly that once we account the value of travel time, the difference shrinks. And when we look at transit, while it is much cheaper as a monetary expense to use transit compared to driving, once we take into account the value of time, or the time that transit users spend, the difference between driving and transit use dramatically shrinks. So this was all descriptive and didn't account for other factors, and we tried to do it using linear regressions to account for those. In a matter of time, I won't focus on all of the predictors, but just to verify the consistency of our model, here we looked at the distance to campus and tried to predict how far the respondent lives from the campus and whether they are the variables that we used in our analysis make sense. And most of them do, because we see that for density squared, and I particularly focus on density squared because the immediate area around the university is very suburban. Historically, that was the area where all the professors lived. Now it's no longer the case because it's too expensive. But after that immediate ring, we have the most densest parts of the region. So that's what the squared variable of density takes care of. And we see that the walk score and transit accessibility go up the closer you are to the campus. But what's more interesting is that we see the inverse relationship between housing and the generalized transportation costs. So we can see that the further you get from campus or downtown, the cheaper housing becomes, but the more you spend on transportation, which is the evidence that we were actually hypothesizing about and wanted to have a proof for. But what we also wanted to explore was whether there's anything that can be done. And we wanted to see whether there are any factors that can influence and reduce the cost of that generalized travel time. And unfortunately, in a car-centric city, if you're driving the car, you're definitely a winner because you spend less time commuting, and that makes your generalized cost of travel much cheaper. However, if you're not going to work every day, if you're working some days from your home, you're obviously saving resources, and that's what our model predicts here. And what we also found was that the factors of the built environment, like transit job accessibility or walk score, they tend to bring your costs down. So it means that if you live in the transit-rich neighborhood that is walkable, you most likely rely less on private vehicle and you spend on transportation less. So it brings us to certain recommendations. First of all, and probably the easiest one, is that the more opportunities for remote work there are, or for participation in conferences like this one where you don't have to travel, the cheaper it is for people or the lower cost for transportation are. Improving transit should cut the travel times for transit users and reduce their generalized costs as well, but it is much more difficult. Even more difficult is to bring the jobs and housing more together, but the concept of 20-minute city is picking up everywhere, so maybe we'll get there sometime. But more broadly, we believe that this study is just a proof of concept, and there is a need to collect such data nationally to examine these trends at the larger scale and not at this small sample size that we've collected across the university. Thank you. If I got your interest, feel free to follow this QR code to get to the full paper that has been published in Transportation Geography, and I'm happy to answer any questions if you have them.
Thanks, Bogdan. So for folks in the room, please feel free to drop any questions in the chat. I'll kick us off with a couple. So I had a couple technical questions, Bogdan, that are perhaps not of broader interest, but are of kind of curiosity for me. So you mentioned that you used R5R to calculate the travel times based on the actual origins destinations.
Correct.
For the auto times, did you assume free flow speeds or did you consider congestion somehow?
Yeah, this is the free flow speed. However, it's not an issue for a city like Edmonton because the congestion is very mild here. And even people who complain about congestion, they just didn't experience the true congestion in cities like Toronto or like, again, Canadian context,
Right.
like Toronto or even Vancouver.
Austin and take it for a spin here.
Yes.
Great. And then my other one, could you go back to, well, I guess you don't have to pull it up, but on slide 11, where you had the distribution of housing and transportation costs.
Yep.
The share of folks that fell into each category. I noticed that on the transportation costs, the bars for walking on the right-hand side of that figure, it was much higher than I would expect. So it seemed like people that were walking there was some share of them that had high transportation costs, like greater than 30%. Do you have an explanation for that? Is that just noise in the data or what's going on there?
I wouldn't say that it's noise. So the thing is that the mode that we asked them to report was the mode that they used to commute to work. But it doesn't mean that people don't drive, don't use transit, don't bike at any other instances. And we had all of the expenses that they made. So basically what the figure shows is the distribution of the mode choice for commute and the housing expenses per every category. But again, it doesn't mean that if you walk to work because you live 5 minutes from campus, you don't drive to Costco or whatever, or you don't own a car. Things like that.
Okay. Got it. Yeah. I wonder if digging into those people to see exactly what's going on with their travel behavior might shed some light.
A little bit more context. We tried to dig in a lot of things. We also tried to dig into respondents who spent more than 30% and both on housing and transportation. But the sample size is not the greatest. So we just didn't have enough variation to explore it further and to look at it descriptively at that level of granularity didn't really make a lot of sense because it might have been just, I don't know, a hiccup or whatever. So we left that out.
Great. Okay, and then you were on time, so we've got a little bit extra time here. So I don't see anything else in the chat, but I'll throw out one other kind of more conceptual question about housing and transportation costs, which is that it seems that it's likely that there are some folks that experience high combined housing and transportation costs, but it's not necessarily a problem in the sense that they're freely choosing that situation, right? They have greater access to amenities, they have access to a particular school district, they like a suburban lifestyle, and there are other people who experience more constraints on their freedom of choice, right? And so those folks have a high housing and transportation cost because they can't afford to live near to where they work. So they have to commute a long distance. They're kind of forced into automobile ownership, even though it doesn't necessarily make financial sense for their household. And I wonder if there's any way that you all have on the survey that you conducted to kind of tease that out, or if that would require a different kind of data collection effort, different set of questions on the travel survey.
So I think it's an excellent question. And I don't think that we have anything in the survey that we've collected to tease those trends out, but I can probably speak a little bit more to the motivation why we wanted to dig into this topic was because we noticed that the choice of whether it's 35% of combined housing and transportation cost share, whether it's 45 or 40, seems to be very arbitrary. Like we have Vancouver, who decided 45% because they relied on the Center for Neighborhood Technology, the combined housing and transport index. But we also have the province of Alberta and Edmonton, who decided that it's 35, and there's no basis for it. So we wanted to show with our data that by collecting more information on how much people spend on housing and transportation, we can have a clear understanding of whether there are these affordability issues. And if we have it at a larger scale, we can first point out and tease out what are the actual problematic types of households, but we can also have empirical evidence to actually meaningfully set those thresholds for transit agencies or for city council to establish some affordability goals and things like that. So that it's not just something that is out of context or sounds good or makes sense, but it's actually empirically driven. And that's where the questionnaire and the intent for this analysis came from.
Great. Yeah, I appreciate your efforts to collect these data directly, because I agree, a lot of the proxies are kind of unsatisfying.
And again, yeah, because usually people use VMTs, they go to BLS in the US to get some of those costs, but directly reported data is hard, and it's hard to collect as well. We had about 2,000 respondents in our survey, but we intentionally allowed people to drop out if they didn't feel comfortable sharing the actual costs, which is usually the case for surveys. So that's why we only ended up with 500 or a little less.
Great. Okay, well, thanks so much for your presentation.
Thank you so much.
And then, so I think Omid, you will queue up Bayan's presentation now, and we'll see it on video. So this was for folks that joined late. We had one presenter, the first presenter who's not here. We couldn't find her video, but I think that we have it now. So we'll go ahead and play it.
Good morning, everyone. I am Tayani, and today I'm going to present my research on equitable transportation and resilience hubs. Analysis of underserved population needs, usage, and travel behavior. This presentation will cover the introduction, methodology, results, and policy recommendations. Unprecedented changes in the global climate have been leading to larger, more frequent and costly extreme weather events. Thus, communities need to increase their preparedness, response, and recovery capacity for climate and non-climate change emergencies. One potential nascent idea is to develop resilience hubs. Resilience hubs are communities serving physical space, created to support residents, coordinate communications and service, and provide resource distribution before, during, or after a disaster. Resilience Hub's key goals are to improve quality of life, provide social service, meet equitable outcomes, enhance community resilience, and provide more efficient emergency management. These resilience hubs can function through different modes: everyday or normal mode. They shift to response to disruption mode during a disaster, and after that to a recover mode. When the community is totally recovered, it goes back to everyday or normal mode. After the literature review, we found that there is no empirical evidence on how underserved communities are going to travel to resilience hubs, what are their transportation needs, where these hubs should be located, and how accessibility, mobility, or the overall transportation network should be integrated to resilience hubs. We conducted an empirical study that we decided to have some underserved groups, low income, visible minority, individuals with disability, older adults, carless, women, and households with children. The methodology was first a data collection in Edmonton, Alberta, through quadric, spinal, and combination sample from November 2022 to February 2023. After that, we conducted data cleaning. Our final sample was 950 individuals that we divided into underserved groups, and we did descriptive statistics and model and distance analysis to compare these underserved groups and identify actionable strategies for resilience hubs location and design. The results are going to cover the association tests, location preference, transportation service and resource, resilience hubs usage, distance from residence, and mode choice. First, the chi-square and the phi coefficients were conducted to understand associations between underserved groups, and the chi-square revealed that there is significant association between individuals with disability and all the other 6 underserved groups. Visible minorities are associated with women and low-income households, low-income households with carless and households with children, carless and households with children, and older adults and households with children. The phi coefficients reveal that these associations were positive and were generally weak, with the phi ranging from 0.078 to 0.193. Regarding resilience hub location preference, the underserved groups are satisfied or somewhat satisfied with most of the buildings, but community centers was the most preferable one for most of the groups, with school being the first option for low income and older adults. Regarding transportation service and resource, accessibility for individuals with disability was the main choice, considered the most important for all underserved groups. For visible minorities, people with disability, and women, it was car parking, the second option. And for carless and household with children, it was transit connection. And B, within walking distance from residence was the second option for low income and older adults. When you think about how these individuals are going to use resilience hubs, we found out that be a place to get information about resilience hub was the first option for most of the underserved groups, except low income, whose first option was be a place to get critical resource during a disaster. The second option for people with disability, women, and household with children was be a place to get critical resource, while for visible minorities, carless, and older adults, it was be a temporary evacuation shelter. Regarding the distance from their residence, we can say that visible minority and carless individuals had the highest median distance, but still small distance because it was 2.2 and 2.4 kilometers. And when we break down the distance by the mode choice that they are going to use to go to a resilience hub, we can see that personal vehicle had the lowest median distance for older adults. The highest distance for public transit was for visible minorities, while the smallest was for households with children. Regarding walking, it was almost the same median distance for all the groups, with the ranging being from 0.4 to 0.7. And for shared mobility, the longest distance is for carless individuals and the shortest for households with children. Regarding mode choice during normal conditions, most of the groups are going to choose personal vehicles to travel to resilience hub, except the carless, whose first option is walking. Walking was the second option for all the groups, and for carless, it was public transit. During an emergency, the mode choice didn't change. Personal vehicle is going to be the first option for most of the groups, and walk-in for the carless individuals. Walk-in was still the second option for most of the groups, except the carless, whose second option is public transit, and household with children that had a shared mobility as the second most selected option. And about the takeaways of this research, we can see that resilience hubs will prefer to be located at a well-known place, and accessibility for individuals with disability was a very important resource for all underserved groups, and trusted connections were highlighted as a key feature. Also, underserved groups will take a personal vehicle or walk to resilience hubs in both conditions, normal conditions and emergencies, but with higher walk-in rates during normal conditions. Groups would use resilience hubs at similar rates during normal conditions and emergencies, and underserved groups population would use resilience hubs during a disaster at a higher rate, especially for getting information about the disaster and getting critical resource than during normal conditions. Some policy recommendations from this research is that for the general underserved group population, resilience hubs should be located within neighborhoods. We should select an existing location that's already well known and well utilized, for example, community centers, community leagues, or recreation centers. Ensure that accessibility standards are met, and integrate multimodal transportation systems to ensure that these underserved groups can reach resilience hubs during normal conditions and during emergencies. Also include resilience hubs in evacuation plans. When we think about carless individuals, this location should have the infrastructure and operation capacity to serve as a resilience hub and as a shelter during a disaster, should also ensure that sidewalks are safe, the crosswalks are available to connect active transportation users to resilience hubs. And public transit roads should be available so these individuals can travel to resilience hubs in both conditions. And when we think about older adults, this location should have sufficient information about the disaster and sufficient resource for disaster's event. And the resilience hub should be within walk distance from the residents, and they should meet accessibility standards for older adults and for the universally design. I would like to thank my co-authors, Dr. Stephen Wong, Veronica, and Narmin, and our funders, the City of Edmonton, Alberta Eco Trust, and MyTex. Thank you so much.
Okay, great. So if folks have questions about that paper, you could reach out to Diane directly. Glad we were able to locate the recording. For our third presenter, we're going to switch up the order from the published program. So we're going to have our the person who was listed as our fifth presenter is going to present in the third slot. So it's Donia Negabani, who will present an EVSE equity analysis framework considering differential job access. Donia, you're going to have to define that acronym in the title right away. So take it away.
So, hi everyone. My name is Donia, and today I'm going to present our research on EVSE equity analysis framework considering differential job access. So in this research, actually, let's start with the big picture. So climate change is a pressing global issue, largely driven by greenhouse gas emission. Actually, in the United States, transportation contributes about 29% of these emissions. To combat this, reducing emission from transportation is crucial. So one effective way to reduce transportation emission is by promoting electric vehicle adoption. However, for EVs to be a viable option for everyone, access to EV charging infrastructure or EVSE must be equitable. So this means that charging stations should be available to all communities, regardless of their socioeconomic status or geographic location, ensuring equitable access to EVSE is essential to more people, encouraging more people to switch to electric vehicles, thus reducing overall greenhouse gas emission. So currently, the distribution of EVSE is heavily skewed toward urban areas. Actually, this urban-centric approach lead to inequitable access, particularly disadvantaged rural region. So rural residents often have to travel longer distances and have fewer public transit options. Actually, this can make access to EV charging infrastructure more critical for them. So without adequate EVSE in these areas, rural communities may struggle to adopt electric vehicles, and it can cause more inequality. So our objective in this project, we have three objectives. So our first objective is to study the travel needs of both urban and rural residents concerning out-of-home charging stations. Actually, this involves understanding the different travel patterns and charging requirements based on where people live. So urban residents typically have a shorter daily commuter and better access to public transit, whereas rural residents are often traveling longer distances and rely more on their personal vehicles. So by analyzing these travel needs, we can determine where charging stations are most needed to support EV adoption in both settings. So our second objective focuses on using job access as a measure to reveal the longer daily mileage traveled by rural residents. Job access actually provide a continuous metric that capture access to employment and amenities required by travel. So by evaluating job access, we can understand the travel demands placed on rural residents who generally have fewer nearby job opportunities and amenities, so leading to longer daily trips. Actually, this insight is crucial for planning charging infrastructure that meets the specific need of rural areas. So the third objective is to assess the current distribution of EV charging stations. We aim to identify how well these stations are spread out in different regions. So particularly urban and rural areas. Our focus is on urban and rural areas. So this assessment can help us to understand the existing disparities in charging infrastructure availability. So let's go to the literature review. So our key finding is that affluent urban area have a higher concentration on EV charging stations. Actually, this unequal distribution leaves rural regions underserved. So this can significantly hindering the adoption of electric vehicle in these areas. The lack of charging infrastructure in rural regions create a barrier for residents who may be interested in switching to EVs, but are concerned about the availability of charging options. So in addition to lack of charging infrastructure, actually rural regions faces several other challenges. Rural residents, typically encounter higher vehicle expenses, and they have fewer transportation options compared to uh, urban residents. So actually, the scarcity of public charging stations actually make it more difficult and costly for rural residents to own and operate electric vehicles. Urban residents generally enjoy, better access to essential services, jobs, education, healthcare. So this disparity is, stark when we consider that rural areas, which are the house of 20% of the population and cover 40% of the roadway, still have significantly fewer EV stations. So let's go to the data. So we used a different type of data for this study. Actually, we use EPA Smart Location Database, which we use, a job access with 45 minutes, the number of job that the census block group can have access within 45 minutes, and we are using the density value. So from National Household Travel Survey, we use a travel mile, travel mode, travel time, and household ID, person ID in the household, and we use the zip code travel time matrix, and we consider the Instacart availability to see if we remove shopping trips, how the trips will change. And also we use American Community Survey data to do some correlation analysis for assessing socio-economic relationships with normalized job access and other things. So in our methodology has 3 steps. So in the first steps, we are doing a travel pattern analysis. The second step is correlation analysis, and the third step is EV access analysis. So in the first step, we are examining the relationship between job accessibility measured by D5AR or job access metric and travel behavior at the county level. Actually, this involves analyzing daily trip miles and person trip miles to understand how job access influence travel distances and patterns. So by doing so, we can identify how different levels of job accessibility affect the travel behavior of residents in both urban and rural areas. So we did correlation analysis, as I mentioned, for comparing, socio-economic factors and job access, and for example, percentage of multifamily housing and other things. So, and then we conduct an EVSE access analysis, so which was the third step. Actually, this analysis highlights disparities in accessibility of EV charging infrastructure, particularly in disadvantaged area. So travel pattern analysis. At the first step, we converted D5AR from census block group level to county level, and then we We analyze the daily trip mile and percent trip mile from national household travel data. And then we are going to visualize the relationship of job access and percent travel mile by using box plots, and we are doing ANOVA test. So we used USDA definition of rural urban. They as you can see in the legend, they provided different definitions for metropolitan areas, non-metropolitan areas, and rural areas. So actually this map shows the job access too. So these black circles show how much job access each region has. For instances, we provided some states to show you how job access and rural urban definition can have a relationship with each other. So actually, these maps highlight, the disparities in job access between rural and urban areas across different states. So urban areas are marked in red, and they have, higher job access, but rural areas shows in lighter shadows. So we can see that urban areas have more job access, and rural has much lower job access. So in the second analysis, actually we are going to show the box plot and the mode share, and also the ANOVA test. So on the left, we have a box plot that illustrating a percent travel mile across different level of job access. So each box actually represent a different job access range. So it start, if you want to consider, it start from rural to urban. So which are measured in thousand. So the y-axis show the percent travel mile. Actually, from this chart, we can observe that the median travel mile remain relatively consistent across all job access categories. And they are around the same central value. However, the variability in travel mile is evident. So with some individual traveling significantly more miles, especially in areas with lower job access. So this consistency in median travel miles suggests that individuals in both high and low job access areas tend to travel similar distance daily. However, the greater spread in the data for lower job access areas indicate that some individual might have to travel further to reach their destination. So on the right, we have the bar chart that shows the mode share distribution for different job access categories. In areas with lower job access, represented in the first few bars, we can see heavily the heavy reliance of people on the personal vehicles. As job access increase, there is a significant shift, which a higher share of trips being made by public transit and other modes. So actually, the use of public transit depicted in the blue becomes more significant in areas with high job access. Similarly, walking and biking and also increase as job access improve. So this shift indicate that areas with higher job access, typically urban region provide more transportation option, reducing reliance on personal vehicles. But in rural areas, as I mentioned, most people are focusing on traveling with their own personal vehicles. So we try to consider, different travel pattern by having a baseline, or we try to get these box plot values by having different scenarios. For example, the baseline, as I showed in this slide, and then we consider the car only, car only excluding shopping trips, and owners, homeowners, car trip excluding shopping trips, and renters car trips excluding shopping trips. So actually, in the baseline daily travel mile, actually this column shows that the general daily travel distance in the first, decile, the median travel distance is 21.8 miles, which in the 10th decile, it is 15.8 miles. And also for other ones, for example, for the second column, which is automobile only or car only trips, shows the higher car dependence in rural areas. And also, when we are excluding the shopping trips, so in when we are excluding the shopping trips, the median distance dropped to 17.6 miles, indicating that travel is some travel are for shopping trip, and the 10 decile is dropped to 7 mile. So for homeowners, actually the median distance was 19.2, and for renters, the median was 20.5. Actually, based on this slide, we can see that rural areas show higher travel distance and car dependence, while urban areas can benefit from shorter travel distances and more transportation options. Actually, when we are considering removing shopping trips, we can consider the availability of Instacart. So if people can have Instacart, they might remove their shopping trips. So then we did the correlation analysis. So in the correlation analysis, we consider several factors like the renter occupancy, private electric vehicle commute, public transit percentage, median income, Instacart availability, normalized job access, and multifamily housing percentage. So the correlation analysis showed that wealthier communities, or mostly urban areas, with advanced public transit, show better job access and reduce reliance on private vehicles. And services like Instacart are more accessible in wealthier neighborhoods, which are urban areas, and also multifamily housing is positively associated with job access in high density, well-serviced urban areas. So the third step that we did was EVSE access analysis. So in this step, at the first, we calculated the travel time between census block groups, and then we calculated the intra-zonal travel time. We calculated the travel speed by using the density value, which is provided by EPA, as I mentioned, and then we calculated the EVSE accessibility by having number of stations and the impedance function. Then we are when we are doing the Lorentz curve, which shows us how much inequity we have, and then we can calculate the Gini coefficient. So for EVSE access analysis, at the end we said that okay, to total access, you know, the normalized job access and the normalized job and EVSE access should have, you know, inverse relationship with each other. So, and our total access is calculated by this formula. So the Lorentz curve analysis here shows that, for example, the plot A and B actually show the cumulative EVSE access. Plot A shows the cumulative EVSE access. Actually, it demonstrates the EVSE access is not evenly distributed, with higher access concentrated among a smaller segment of the population. Graph B actually depicts the cumulative job access, showing a similar pattern of concentration of jobs in rich areas or urban areas. So the third analysis shows actually the inverse relationship that we provided. Actually, this graph demonstrate the inverse relationship between job access and EVSE access, emphasizing that areas with higher job concentration tend to have fewer EVSE resources per capita. So by using this visualization, actually this visualization shows us the inequity in EVSE distribution relative to job access. And this analysis can help us, you know, to understand the disparities and inequity in EVSE access. So in conclusion, we can see that, you know,
Donya, we have to wrap up. I'm sorry, you're a couple minutes over time. So can we just
sure, okay.
cut it?
So actually our study reveals that, sorry. Our study reveals that the relationship between EV demand and between EV demand supply and job accessibility is inequitable, and there is a significant difference in commuting patterns exist between rural and urban areas. So this project is funded by NSF, and I want to introduce our contributors, so Rida Mori and Paul. So if you have any questions, sorry about, you know, the time. So if you have any questions, you can ask in the chat box.
I'll ask one and then we'll move on. But I guess I have a big picture question, which is just, do we have any evidence that there's actually demand, there's unmet or latent demand for electric vehicle charging infrastructure in rural areas, especially in the United States, where the question of vehicle choice, like all choices that people make in the contemporary era, has become politicized.
Mm-hmm.
I don't see high levels of EV adoption in rural areas being the solution to rural mobility issues, but maybe you have a different perspective on that.
Yes, we didn't, you know, we didn't actually analyze about, you know, that part, but it's a good question. We should, you know, do that in our future study.
All right, thanks so much.
Thank you.
We'll move on to the next presenter. So we've got Veronica Wambura up next. who will present on incorporating a public transit equity lens in evacuation planning. So Veronica, over to you. If you want to give a more extended bio, you're welcome to do that.
Can you see my screen?
Yeah, we can see your PowerPoint deck. If you full screen it, there you go. Looks good.
Okay, thanks. Yeah, so my name is Veronica Ombura. I am a Master of Science student in Transportation Engineering at the University of Alberta, and I'm also a member of the Resilient Mobility and Evacuation Group at the university. Today I'll be presenting my research titled Incorporating a Public Transit Equity Lens in Evacuation Planning. So I'll be roughly following this table of content, starting with the introduction, then the methodology, results, policy recommendations, limitations, and then the conclusion. So starting with the introduction, what motivated our research? So previous studies continue to show that vulnerable populations are more negatively impacted by disasters, whether these disasters are caused by climate change or whether they're human initiated. And specifically looking at the evacuation lens, evacuation planning is often done around automobiles. And this means that usually when emergency management offices send out evacuation alerts or orders or routes, there's an assumption that individuals have personal vehicles to be able to evacuate from an emergency scenario. However, this is not always the case. And as we saw from the Hurricane Katrina of 2005, almost 100,000 people lacked access to personal transportation, and many of these were lower income households, people with disabilities, and older adults. And previous studies from this hurricane found that almost 70% of the people who died during this hurricane were actually older adults who weren't able to evacuate themselves from this disaster. Now, an excessive reliance on automobiles often also leads to situations like this. So during Hurricane Rita, the image on the left is from Hurricane Rita of 2005, and the image on the right is from the Fort McMurray wildfire of 2016. This was in Alberta, Canada. In both of these scenarios, everyone who had a personal vehicle tried to evacuate with them, which led to impassable traffic jams. And this can be extremely dangerous, especially in a wildfire scenario, for example. So from our literature review, we found that due to the scenarios, the general direction of transportation research now is towards a more multimodal approach to evacuation planning. And so this means that transportation researchers, planners, and engineers are calling for a better incorporation of public transit in evacuations, both to evacuate vulnerable populations, but also to eliminate traffic congestion during evacuations. However, while we found that there is a growing number of literature on public transit logistics, for example, optimizing bus routes, pickup locations, or even the number of drivers during emergencies, we found that there is no real understanding of who will even use public transit during an emergency and what are their evacuation needs. So this led us to ask several research questions. First, what challenges do underserved populations generally face during evacuations? Second, what are the unique transportation needs of different underserved groups in the context of an evacuation? And third, how can emergency evacuation planners and transportation agencies equitably meet these identified needs and challenges of underserved groups? Our objective in asking these questions was to develop an understanding of transit needs and challenges and to inform more equitable approaches to evacuation planning. So moving on to the methodology, we used the city of Edmonton, Alberta as our case study, and we used focus groups as our methodologies. And we wanted to use focus groups because we wanted to hear directly from the underserved groups themselves. So we had 8 focus groups, and the table on the screen shows you all the focus groups as well as their eligibilities. And we had carless residents, individuals with disabilities, older adults, lower income households, racial and ethnic minorities, recent immigrants to Canada, parents and guardians of young children and women. And we conducted the focus groups in February last year, between February 2nd and February 23rd. We had a total of 52 participants, and we asked them questions around their evacuation decisions, so whether they would evacuate or not, given an emergency order. And we also asked them about how prepared they felt for an evacuation, what transportation modes they would use to evacuate. And also we asked them for their own recommendations for public transit use and improvements during evacuations. And to analyze the data, we used MaxQDA. This is a qualitative coding software, which enabled us to perform both thematic and content-based analysis. And it also enabled us to identify recurring themes that emerged during the focus group discussions. So moving on to the results, first going through some general evacuation results. So we found that when we asked about their evacuation decisions, a majority of the participants say that they would evacuate. This was around 82% of the participants. And then we found that around 18% say that their decision would be dependent on the disaster. We found that no one from the focus group said outrightly that they would not evacuate during an emergency. And then when we asked them about their preparedness levels during an evacuation, we found that as much as almost 82% say that they would evacuate, only 38% say that they were prepared for an evacuation. And more than half say that they were not prepared for an evacuation. 9% say that they were uncertain about whether they were prepared or not, and they didn't really know what preparedness procedures look like. And then we also asked them about whether they were comfortable providing their information to emergency registries. So emergency registries are essentially voluntary databases that are usually set by the government, and underserved groups or people who need specific accommodations during an emergency would register their own information voluntarily in order to receive these accommodations during an evacuation. And we found that almost 88% say that they were comfortable with providing their information to registries, and around 12% say that they were not comfortable due to confidentiality issues primarily. And then when it came to transportation modes that the participants would use during an evacuation, we found that many say that they would use their own personal vehicle, so they would drive, around 32 or 33%. And then some of them mentioned that they would use public transit during an evacuation. This was around 24%. And many of these say that they did not have personal vehicles to be able to evacuate themselves, so they would rely on public transit. Interestingly, we found that around 19% say that they would walk during an emergency evacuation. And some people who mentioned this say that they were not able to afford the public transit fare to evacuate, and they also did not have personal vehicles. And the rest of the participants, some mentioned that they would ride with friends or family during an emergency, some would take a taxi, and some say that they would carpool with others. Now, looking at specific themes that came up during the focus group discussions, we found that reliability and accessibility were being discussed the most. And in terms of reliability, the participants mentioned that they would want to know that transit is readily available during an emergency, and it has sufficient capacity to evacuate everyone who needs to use public transit during an emergency. We also found that accessibility was a key theme, especially for people with disabilities and older adults, with many of them calling for accessibility features in transit or in any transit vehicle used to evacuate them, for example, school buses. And they also wanted to know that there might be, that they would receive assistance to be able to evacuate. Many of the people in this group mentioned that they would not be able to leave their houses or apartments without receiving significant assistance. And so they wanted to know that there would be someone there to assist them even in getting on the transit vehicle. And then we found that affordability was also a key theme, with many people saying that they were not able to afford transit fares. And so they wanted to know that during an emergency evacuation, transit would be free or even have reduced fares so that they would be able to evacuate. We also found, surprisingly, that social cohesion was a key theme. And some of the people who chose to use public transit during an emergency evacuation say that they would choose this mode because at least they would be able to evacuate with other people rather than evacuating alone in a personal vehicle. And some of them mentioned that evacuating with other people in a bus or in a train would help reduce the feelings of anxiety and panic that come with an emergency evacuation. Safety was also a key theme, with some of the participants saying that they wanted to be sure that transit would be safe and secure during an emergency. And then some of the participants also mentioned that they would use transit because at least it will be able to evacuate a lot of people and therefore reduce congestion. And I also wanted to look at the themes that came up for each group and specifically highlight some of the major themes. So among the individuals with disabilities, again, we found that accessibility was a key theme for them, and especially even having some assistance on transit, whether it's medical assistance or physical assistance to get on the transit vehicle to be able to evacuate safely. Among the lower income households, we found that reliability was a key theme. And this was especially because many of them already rely on public transit for daily mobility. And so they wanted to know that transit would continue to be reliable during an emergency evacuation. Among the women, we found that affordability was a key theme, especially the women from lower income households who mentioned that they would like for transit to be free or have reduced fares during an emergency evacuation. So moving on to the policy recommendations, our biggest recommendation based on our key findings was that there should be increased collaboration between emergency managers and transit agencies. And with this collaboration, emergency managers and transit agencies should prioritize first reliable transit services, accessibility features, medical and physical assistance in transit, and also affordable or fare-free transit for eligible evacuees during emergencies. With this collaboration, emergency managers and transit agencies should also consider ways to build social cohesion around transit and evacuations. This was a key theme in our focus group discussions. And so emergency managers could consider ways to bring people together during an emergency. And this could be, for example, creating volunteer opportunities for individuals to assist older adults, for example, in getting on transit. And this can bring communities together and create that sense of community resilience. We also recommend that they consider establishing emergency registries. Not every city has an emergency registry for people to voluntarily register their needs or accommodations. And so cities should consider building these emergency registries for people to register their needs. And in this way, emergency managers can prepare resources beforehand in case of an evacuation. And so moving on to the limitation, we recognize that one of the limitations of our study is that we only had 8 focus groups and with 52 participants within the city of Edmonton, Alberta. And while previous studies have shown that this is a sufficient number of focus groups and a sufficient number of participants to be able to identify key themes, it's still just one city and one study. And so we recommend that other cities and jurisdictions perform a similar community-centered study in order to identify key themes or needs for the underserved groups in their specific jurisdictions. And so in conclusion, our study found that evacuation planning in North America is still largely centered around automobiles, and simply planning for transit evacuations is not enough. So emergency managers should collaborate with transit agencies to ensure reliability of transit, affordability, and accessibility. Because social capital is also a key theme in our study, we recommend that social capital around transit be built in order to foster community resilience. And finally, we believe that the needs and insights of underserved populations should be considered and integrated into evacuation planning. I would like to acknowledge the City of Edmonton and the Alberta Eco Trust Foundation for funding our project. And that is all. Thank you.
Thanks, Veronica. So for folks that are in the room, again, feel free to drop any questions for the presenters in the chat box as they're speaking. So I'll kick us off again. So first, I really appreciate seeing a qualitative paper in forums like this. I think qualitative methods are, they're difficult to execute well. The data are really unruly that you generate. It's really hard work. And folks with more quantitative backgrounds often look disparagingly, I think, on qualitative data. But you can see from the types of results that you share that you can get some really rich insights, especially in areas of the literature and practice that are relatively underexplored. Qualitative research can be really useful. So thanks for sharing your work. I've got a few questions. So first, I like the idea in principle of public transit playing an important role during disaster and for helping with evacuations. I guess I'm skeptical about how well it would actually work. And I was surprised that such a high share of your focus group respondents said that they would evacuate using public transit. I think it was private vehicles were the highest category and transit was the second. So what do we actually know from the literature about how well transit works in these situations? It seems like it'd be really dependent on the existing context, the level of service, the transit modes that are available, people's familiarity with it. But do we have good examples of where it has worked to evacuate folks during a disaster?
Yeah, I actually wanted to mention that I think we saw a high number of people who would use public transit in our study. mostly because we specifically focus on underserved groups. So the results could be different when you look at the general population versus populations who are typically already inclined to using public transit. And so because they're already using public transit for daily mobility, it wasn't too out of the line to expect them to use public transit during an evacuation as well. Now, public transit isn't normally used for evacuations, and so this is kind of what we are calling for and advocating for. A city that has been implementing public transit use is actually New Orleans, and this was after Hurricane Katrina, especially because so many people suffered because they weren't able to evacuate themselves, and most people did not have personal transportation. And so New Orleans has a very well made up system for using public transit during an emergency. I would also say another city that has an evacuation plan in place for using public transit is actually New York. And they have evacuation zones based on the severity of the disaster, and they have specific forms, so like emergency registries for people to register themselves and mention that they would need transportation assistance. And so they have systems in place to be able to use public transit. Now, in our city where we focus this study, the city of Edmonton, we still do not have an evacuation plan in place for using public transit. However, we are currently working with the city who funded this project to be able to have those plans in place for people who would rely on public transit during an emergency evacuation. So it's still a work in progress.
Great, that makes sense. And then I'm curious about the participant recruitment and any incentives that you provide, and also the mode. Were the focus groups in person or online? And if they were online, one issue that I've had in trying to run similar focus groups or discussions is that we have kind of like bad faith actors that will sign up and they're kind of difficult to weed out. Like they're just after the incentive that we're providing. So yeah, I wonder if you could just talk about your kind of recruiting strategy and how that went.
Yeah, so the presentation that was done by Tayani, we had like a survey for the study on resilience hubs, and out of that survey, we asked the participants from that survey study whether they would be interested in participating in a focus group study. And so that was one of the ways we had focus group participants, but also another way was we worked directly with groups in the city of Edmonton that work with underserved groups, so like community-based organizations that work with newcomers in Canada or older adults, like senior group associations. And so they enabled us to receive participants. And we did have an incentive. We had around $75 for the people who participated. I'm not sure about whether some of them were just acting to be able to get that incentive. It's hard to know. But we did have that incentive to kind of appreciate their time. And the focus groups were online. I think we used the online methodology because it enabled us to reach a wider group of people without the constraints of having to travel somewhere to get to the place.
Yeah. Yeah, it's hard to deal with that problem. I think in our case, we had a situation where people would just basically log into the focus group and then not participate. And so we
Right.
have to set a requirement like you have to participate, but then yeah, it's not clear if they're, genuine participants. So I'm not exactly sure what to do about that problem, but
Yeah.
one other thing that just occurred to me is that I assume all the focus groups were conducted in English. And is that an issue in Edmonton? Like, would you have had a more diverse group of respondents if you offered in different languages?
I would say it's not a big issue. I know like in the US, there's a large group of Spanish speakers. So maybe that could have been a consideration if the focus groups were done in the States. But in Canada, we didn't have an issue because it's such a diverse city. There's people from all over the world. And so there wasn't one specific language that needed to be done for the focus group discussions in order to accommodate a specific group of people. So all the focus group discussions were just done in English.
Got it. Okay, great. Well, thanks, Veronica.
Thank you so much.
So we will move to our last presenter, who is been acting as our dedicated tech support for the session. Omid Armantalab. Omid, do you want to take it away? And we're perfectly on time.
Can you see my screen?
It's up, yeah. Can you full screen the slides?
Yeah, sure.
Great, looks good.
Okay. Hello, everyone. I am Omid Armantalab, a PhD student in transportation engineering at the University of Nebraska-Lincoln. Welcome to my presentation of my research on transportation access equity analysis in 2 US cities using Bayesian inference-based Logsum compensation variation metrics. This research is co-authored by Dr. Hawkins and Dr. Hasni. Equity in transportation is a critical issue for both moral and research reasons. From a moral standpoint, there's an imperative to ensure that transportation services are fair and accessible to everyone, regardless of their background. Research-wise, the challenge lies in the lack of adequate data and analytical tools, which hampers our ability to conduct true and effective equity analysis. Addressing these issues is essential to advancing our understanding and improving transportation systems to serve all communities equitably. We utilize a Bayesian hierarchical model in this analysis, which incorporates race and income variables to generate distributions of benefits or losses resulting from transportation policy changes. This model is applied to 2 major US metropolitan areas, the San Francisco Bay Area, MTC, and Minneapolis-St. Paul area, Met Council. Our approach not only shows the distribution of benefits and losses for each region, but also compares them. Additionally, we examine how these distributions vary among racial groups for different transportation improvement scenarios in both regions, providing a nuanced view of equity impacts. Here we compare 2 maps. On the left, we have the MTC area with a population of 7.7 million. On the right, the Met Council area, which has a population of 3.2 million. Although the Met Council area covers larger geographic regions, its population density is lower, resulting in a more dispersed area compared to the more densely populated MTC region that we can see on the left-hand side. The hierarchical logic model used in our analysis is parameterized with equity-related variables, race and household income. Especially the Logsum consumer surplus measure for a mixed MNL model is defined for individual travelers, reflecting how changes in transportation policy impact their perceived benefits. For our data, we use the MTC dataset from the 2018 to 2019 Transportation Network Company Survey. For the Met Council in Minnesota, we utilized travel survey data collected from 16,152 individuals during the same period. This slide shows the sample composition for both MTC and Met Council datasets. We can see that, for example, in Met Council, we have more people using auto compared to MTC regions. And also we can see that, for example, people have a mean income larger in MTC compared to Met Council. And also other variables are here to see the comparison between these 2 regions. We have the posterior parameter distributions for the Met Council in this table. we have actually calculated the willingness to pay for each race and also travel mode. For example, the first row is showing the auto for different races. That, as we can see, for example, auto white has the willingness to pay of about $15 per hour, which is higher than other races. And also we can see that it is the same in other travel modes by having more willingness to pay for auto compared to active and transit modes. We have the same information, the posterior parameters from our model. For MTC region, we see the kind of similar patterns, but overall the values are higher than Mid-Council. As we can see, for example, the maximum here is for auto and white race, which is $24 per hour, which is higher than what we had for Mid-Council. Yeah, here for Mid-Council it was 15. Now here it's 25, but we have the same pattern for other modes and other races. As we can see, for example, white race is again having the most willingness to pay compared to other races in auto. We have calculated the average change in Logsum values by races that we can see in this table. We have different scenarios. The first scenario is overall travel time reduction. The second is auto travel time reduction, active travel time reduction, transit travel time reduction, and overall travel cost reduction. For each scenario, we have the average values for each region. We see that, for example, there is not a big difference between races. There is a difference, but it's not very significant. But we can see that, for example, the values for overall travel time reduction and auto travel time reductions are larger than other scenarios. So we can see that people are benefiting more in both regions from overall travel time reductions compared to other scenarios. We have also the change in Logsum accessibility due to 20% reduction travel time in MTC. We have it for different races. What we can see in these plots is that, for example, for the first plot, this plot, we see the overall travel time reduction. So we have decreased the overall travel time by 20% for all individuals. And we can see, for example, in this picture that these dotted lines are actually the minimum and maximum for each race. For example, the blue dotted lines, this one and this one are the minimum and maximum, and the solid line is the average. And how we have calculated these ones, because Stan gives us the samples. We had 400 samples produced by Stan, and between those 400 samples, this is the minimum for the black race, and this is the maximum, and this is the average. And we can see that, for example, for black race, we have also the maximum benefits and also the minimum benefits, comparing to, for example, comparing to, for example, white race, which has a very close minimum to maximum, so it's consistently higher than others. And if we look at all of these plots, we can see, for example, the benefits that people are receiving from reduction in transit travel time is less than other scenarios. We can see, for example, most people are benefiting in this area, which is very small. But for example, for overall travel time, we have larger benefits that people are receiving and also for auto and active, they are benefiting more than transit. We have the same plots for Mid-Council region. We can see, for example, we have kind of similar pattern for transit travel time, but we have also very low benefits for active. For example, if we can see, we want to just compare active for both regions. In Mid-Council, we see most people are benefiting very little from active travel time reduction, but in MTC, they are benefiting more from active travel time reduction. We have also other plots for auto travel time and also overall travel time reduction. As we can see, we have again the minimum and maximum for each race, which kind of shows the variation that we have for each race. But for kind of all plots, we see, for example, the white race is consistently high and not having a lot of variations compared to other races. And we have also the other scenario, which is 20% reduction in travel cost. We have it for both regions. We can see, for example, in Mid-Council, people are benefiting a little bit more from this scenario than in MTC. In MTC, we see a small peak here, but we can see that in Mid-Council, that shows in Mid-Council people are more consistently benefiting from travel cost reduction. And to conclude, in summary, our analysis reveals that white travelers generally have a higher willingness to pay for transportation improvements compared to Black and Asian Pacific Islander travelers. The willingness to pay estimates for Mid-Council region tends to be lower than those for the MTC region. This difference may be due to lower mode share and the relatively smaller impact of transit and active travel time reduction in Mid-Council region. Conversely, reduction in auto travel time have a more significant effect on access in the Mid-Council region compared to MTC region. I want to thank Dennis Farmer, Shimon Israel, Lisa Zorn, and Castic Loan for providing the travel diary and schemes data.